love finding ways of being able to sort of demonstrate and talk about what I'm thinking and feeling when I'm working with scar tissues. And I was walking my dog through these beautiful fields this morning, and I was passing this cut grass where they've mown the field, and I just thought, oh, do you know what, the way that the healthy grass is around, there's obviously been a lot of hot weather and lots of the areas got damaged and dried, and then the grass has been cut and it was just sort of sitting in clumps and little piles. And I thought, you know, that really reminds me of when I'm working with clients. And the reason is when you have a surgery and your body is rushing to heal the wound, you've got lots of different components going on. It's never going to be the same repair to healthy tissue or to pre-injured tissue. So any kind of scarring that happens following a surgery or following a severe accident, the tissue that has been rebuilt following that is never going to be quite the same quality. The body rushes to kind of create new tissue, and it kind of, a bit like this straw here, the tissue that it produces is a bit thicker, it's a bit more clumsy than the healthy tissue. So such as this grass would be my equivalent of your healthy tissue within your body. And the scar tissue is this kind of, it's quite thick, it's drier, it doesn't really allow the flow of fluids. It can get really sticky because your body's trying to have these sticking components to the scar healing, because it's trying to draw both sides of the tissue together and try and knit them and try and stabilize the area. And that's another thing that can happen, is as your scar starts to heal, you can start to get adhesions, which is sticking underneath to the tissues underneath. So this glass kind of being flattened down here kind of was making me think, oh, it just makes me think about when I'm working with a client and they've got this stuck, thicker, drier lumps of tissue, and it just, to them, they talk about disconnect, they talk about not liking to touch it. And sometimes, you know, many clients will have scars that will heal beautifully on the surface, and these issues are what's happening beneath the surface. So when we talk about ScarWork, we're not just limiting ourselves to the fine line, or perhaps if it's keyhole surgery, just that little mark on the surface of your skin. We're looking at the damage that's happened in the tissues underlying, and we're really working to try and address those. And the way that we like to do that is not to come in and compress those tissues. If you think about what I've been saying, that these are thick tissues, they're dry tissues, they're anyway stuck down, then coming in and doing deep compressions on them like I might be doing here is not going to be what's needed to try and loosen that up and get it to reintegrate into the body, try and get it to be absorbed and reduced in size. The less fibrous tissue, more healthy tissue is what we're aiming for. So instead with ScarWork, we're really looking to do light movements. We're coming in from the healthy tissue. If you think about this being, you know, the rest of your body, a healthy part of your body where you've got good blood and lymph flow, you've got a great mobility between the sliding structures, so like, you know, your tissues slide easily on top of each other, and then where the scar is, you're going to have this quite stuck place. So what we do with ScarWork is really try and kind of come and creep up on the scar from the edges, and really trying to lift and mobilize that, and then try and really get that to integrate within the surrounding tissues, trying to get the body to reabsorb some of the thicker, harder lumps of scar tissue, trying to kind of knock on that process, so hopefully your scar will be more reduced, it will feel more comfy, it will feel more integrated into the surrounding tissue, in the sense that hopefully as you run your hand along the scar from the healthy tissue into the scar tissue and then back into healthy tissue, you're really noticing less of a change. It feels more consistent, as opposed to it being a really tight scar, you're coming from healthy tissue, bang onto scar and then straight off again. So those are the kind of things that we're thinking about when we're working with scar tissue.